The patient is sitting. The examiner places one hand under the patient's chin and the other hand under the patient's occiput. The examiner then slowly and gently lifts the patient's head upward. With a positive sign, the pain in the neck and into the upper extremity is relieved or decreased when the cervical spine is distracted. The patient sits and laterally flexes their cervical spine to one side. The examiner presses straight down on the patient's head. This procedure is repeated to the opposite side as well. A positive sign is pain radiating into the arm toward which the cervical spine is flexed. The patient sits and places their cervical spine in combined extension and rotation, such that they are looking back over their shoulder. The patient must keep their eyes open. This is performed for 20 seconds on each side. A positive sign produces rapid eye movements, dilated pupils, dizziness, syncope, and lightheadedness. The patient sits and performs combined extension, lateral flexion, and rotation. This reduces the size of the intervertebral foramen. Have the patient keep their eyes open in order to observe nystagmus if it occurs, which may be indicative of vertebral artery compression and resulting lack of blood supply to the brainstem and cerebellum. With a positive sign, pain radiates into the arm toward which the head and cervical spine is extended, laterally flexed and rotated, which is a reproduction of the patient's symptoms. The patient stands and the examiner stabilizes the patient's head by holding the patient's head with their hands. The patient then rotates their trunk and holds maximum rotation for 20 seconds to each side. A positive sign includes rapid eye movements, dilated pupils, dizziness, syncope, and lightheadedness. This second test is used to help rule out an inner ear problem as the cause of symptoms. If these symptoms are not induced, the cause of dizziness was most likely not an inner ear problem.